Hi, I'm Joseph Talley. I do operations management for Catalytic Health Partners. Well, after working in banking for 10 years, I wanted to move to a different industry, and healthcare attracted me because there's a lot of different things going on within healthcare. Whenever I was looking to move over was just after the implementation of the Affordable Care Act. So healthcare was changing. I thought it would be a good time to start in the industry and see if there was some way that I could use my skills to help make a difference. And I wanted to move to a company that had a goal of making a difference in people's health and their lives.
What is your role and your primary responsibilities at Catalytic Health Partners?
I help manage the operations and help the field team in their constant movements and management of the members. So a lot of that includes helping them look at the data that our members have and read through what that might mean on a medical side, getting their feedback on the medical, me giving feedback on what the data means, and then helping out with getting everyone surrounded around the culture of the company. So as we bring on new team members or existing team members, kind of going over what it is we should be doing to match the company's goals. So that's kind of on the daily basis what I'm looking to do.
And can you state your full name? Your role?
Joseph Talley, operations manager.
Thank you. What three things do you love about your work?
Three things I really like is one, working with each individual person. So helping them, for all of them, it's growth because it's not the same thing they've done in the medical field beforehand or in the behavioral health field beforehand. So helping them with that growth. I get to interact with members on occasion, which is great. Kind of seeing what type of impact we're making from kind of the outside perspective versus those who go in each day. And the last thing is the business side. I get to be involved a lot in that side and helping make the decisions that impact our ability to help those members.
Excellent. Can you share with us a member experience that made a difference, improved an outcome, or enlightened the client about a better way to achieve their goals?
Yeah, so we have a member that lived down the street from me, Robert Kimball, and it was very enlightening, the ability of us to be able to go out and see him routinely, because one of his goals really centered around the fact that he just wanted independence. He wanted to be independent of the healthcare system. He wanted to be independent of himself. And so by the time that we got him moved to an independent lifestyle and one that was in a cleaner home than where he was at, it then turned into, well, how do I get things that I need to essentially live? Toiletries, toothbrush, those types of things. And so being able to be there for him, and we helped him out not only in the idea of getting those things, but how he could afford it. So at first we were giving them to him, and then by the time we helped him out with a budget, which I believe Angel, one of our behavioral health specialists, did with him, is helping him figure out a budget, but then getting him to that point where he was willing to go buy it himself, which he wasn't willing to do in the past, but then he just needed a ride there. So we were providing some type of transportation or other times just some type of encouragement to get there. And so a lot of times I was there for either dropping off items or taking him to the places that he needed to go, since I was the one that lived closest to him.
That's great. If health plans knew this, they would always choose to partner with CHP to improve health outcomes of their members.
I think if they just knew the impact that a one-on-one conversation has in the member's home, they would choose to contract with us every time. It's something that's been a little bit lost in healthcare, is that one-on-one time with a provider, not just an office staff member or those types of items. But by having our providers and our provider support team really sit in a member's home and have a one-on-one conversation, they learn what's important to the member, but also they learn how the member chooses to be helped. Sometimes in healthcare we make that decision for them, versus in our model, we're able to get their input as how we can best help them.
What one thing should people know about you?
For me, it's hard. I guess it's the idea of being committed to the culture that we want to put through. At the last company I worked at, there was a very big initiative around culture, and so I got to learn why that's important. And so then moving over here, that's something that I latched onto, is this idea of how do we build a culture, how do we keep a culture, and a lot of that comes through training. And so that's one of the reasons why I volunteered to be part of the training process for everyone, is so that I can help instill it from day one, but then it also helps to make it easier to coach it throughout the time.
That's great. If you could be any superhero, who is it and why?
Any superhero? It's hard. So for superhero, I'd probably choose Superman, mostly because he can do everything. So you don't have to worry about watching another superhero and be like, I wish I could do that. That's always a good thing.